The Swiss Patient Safety Foundation would like to welcome you all to its webinar with the title, What Matters to You? My name is Andrea Balmer. I am a research assistant at the Swiss Patient Safety Foundation, and it is my pleasure to moderate this webinar today. Today's webinar stands in the light of the upcoming Patient Safety Awareness Week, which will start next Monday. The slogan of this year's Action Week is More Safety for Patients with Patients. So in other words, we are really focusing on the topic of patient engagement this year. And in reference to this topic, we are very pleased that we can now introduce the international campaign, What Matters to You? A campaign that has been implemented with great commitment over the past 5 years in the French-speaking parts of Switzerland, and which we will now broaden out to the German-speaking parts of Switzerland, as well as Ticino. The campaign fits very well with this year's Action Week theme, as it underlines a partnership relationship between health professionals and their patients, which of course in turn can also have a positive influence on the quality of treatment and patient safety. So after this quick introduction, let's look at today's webinar's program. The first part of today's webinar will be dedicated to the origin and development of the international campaign, What Matters to You? And in the next step, we will then hear about implementation experiences made in the French-speaking part of Switzerland with the campaign. And of course, at the very end, you will also have a chance to ask your questions to Anthony Staines, our speaker, and enter into a joint and hopefully lively discussion. Now, before I introduce our speaker, Dr. Anthony Staines, I would like to point out that we will be recording this webinar and later post it on the Patient Safety Awareness Week website. We're very pleased that so many of you are joining this live webinar, and please feel free to ask questions via chat or also live in English, French, and or also in German. Anthony Staines will be happy to answer your questions at the dedicated time slots during the webinar. Now, it is my absolute pleasure to introduce you to Dr. Anthony Staines. Chances are that you have already met or heard of him, as he is a master of networking and can be found as an expert at many conferences and congresses. He has been active in the field of patient safety and quality improvement for many years and continues to do so with constant commitment and passion. After a Master of Business Administration and a Master of Public Administration, Anthony Staines obtained a PhD in Management at the University of Lyon. He is the author of a doctoral dissertation on the impact of hospital quality improvement programs on clinical outcomes. And he currently runs a portfolio of patient safety improvement projects for the Federation of Hospitals of Canton Vaud in Switzerland and advises a number of institutions on patient safety strategies and projects. Together with Charles Vincent, he recently also co-authored the Swiss National Report on Quality and Safety in Healthcare. So I think it is fair to say that he has lived a truly extraordinary career, and he's a great supporter and a good friend of the Swiss Patient Safety Foundation. We're therefore very pleased that he will now introduce us to the What Matters to You campaign. Anthony, the stage is all yours.
Thank you very much, Andrea, for this kind introduction. And I'm happy to be with you this afternoon. So as Andrea mentioned, there will be two parts in my presentation. The first will explain the approach and the history, and then that will be about 20 minutes. And then I'll stop for a while. We can take some questions. And then we'll have the second part to share some experience of what we have, what some institutions in our canton have implemented. So let me just share my screen. Here we are. Lovely. So to start with the approach, the origin of the idea of what matters to you comes from a paper published in New England Journal of Medicine by the two authors that you can see on the screen at the moment. The title of the paper was called Shared Decision Making, the Pinnacle of Patient-Centered Care. And in that paper, the two authors advocated that the clinicians would relinquish their role as the single paternalistic authority and become more like coaches for patients or partners, learning from patients. And this meant not only to ask the question, what's the matter? Meaning by that, what is your health problem? But also what matters to you? What are your preferences, your values, your choices, etc.? And so that was in that paper. And the sentence was memorized by Maureen Bisognano, then president of Institute for Healthcare Improvement in Boston. And the Institute for Healthcare Improvement organizes annual forums, some in Europe, some in Asia, some in the United States. And at the Paris Forum in 2014, Maureen Bisognano went about convincing her audience to use more frequently this sentence, what matters to you. In the audience was my friend Anders Berge from the Quality Improvement Unit at the Norwegian Institute of Pelvic Health. And Anders thought, that's a very interesting idea. I should test that in my collaboratives on improving care in Norway. And so he did preach or spread the word about this in his collaboratives. And it led to various campaigns in the collaboratives. And you can see post-its, you can see badges, etc. And little by little, he teamed up with other colleagues from other countries. And the idea came up that there should be a campaign, an international campaign to raise awareness about patient partnership and using the sentence, what matters to you. So June 6th was named the International What Matters to You Day. Of course, the idea is not to use what matters to you just on the 6th of June, but to use that in everyday clinical practice with every patient. But the day, the International Day, is a way to raise awareness and to extend the message. So what is it all about? The concept of what matters to you. Let's start with the what. The idea is to understand the point of view of the patient, the priorities of the patient, the environment, the history, the life circumstances, and by understanding all that, to build trust and develop empathy. And this trust and this empathy, in turn, allow the patients to express their needs, their values, their preferences, because they feel listened to, they feel that what they say is valued. And so what matters to you is the entry door to that universe. It's the question that initiates the partnership with the patient. So who should ask this question? Well, anyone working in healthcare, anyone in contact with the patient can ask this question. We just recommend that the person asking this question at the next handover with the team briefs the team about what has been said by the patient, so that the patient doesn't get asked the same question every 2 hours during care, but it can be anyone who initiates the question. When should the question be used? Well, the interaction is welcome at any time, and the best you can do is to really integrate it in your care. So if, for instance, a nurse is seeing a patient for the first time and is taking the case history, well, asking the question, what matters to you in your care, what matters to you in your situation, etc., is a very good idea. It could be during the medical rounding that what matters to you is. So the ideal is that it's not extra work, but it's integrated in daily care. Now, there are some times when it's really crucial to ask this sentence, which is when the disease begins to impact the quality of life, or when there are some delicate announcements of a diagnosis which will worsen the quality of life. These are moments where the interaction, starting with what matters to you, is really important. So how do you go about it? Well, you start with the question, what matters to you, or something like it. It could be what's important for you, or what matters to you today, or what would you like us to know about you? What is your goal today? All these are variations of the same question. The idea is to create the contact, and not the contact just on the disease, but on the values, the preferences, the environment of the patient. So ask what matters, listen actively, which means rephrasing, making sure you understand, request validation, then take into account what the patient has said. As you notice, I'm not saying do everything that the patient asks. It's perhaps not always possible to do absolutely everything that the patients ask. So our commitment, I believe, is not to do everything that the patient asks, but to listen carefully and then to reflect personally and with the team, what can we do about what we heard? How can we use that to partner with the patient for his or her care? And also to leave a trace. I will talk about whiteboards, bedside whiteboards, or it could be in the team briefing, in the discharge document. So leave a trace of what you have heard. So the philosophy is the partnership with the patient. You have here a slide that shows the Montreal model of patient partnering with patients. So the idea is to say in time, let's say in the 1970s, 1980s, we had more paternalistic approaches. That means we believed we knew what was best for the patient and didn't ask the patient so much. So the team, which is in the circle, came up with an intervention plan for the patient and for relatives. From there, we moved to patient-centered approaches, represented by the team around the patient in the center of the circle being the team, and the team doing things for the patient that is in the center. And the Montreal model encourages us to move to the next step, which is a patient as partner approach, where the patient is not in the center of the circle, but is in the circle together with the team. So it's no longer doing things for the patients, but it's doing things with the patient. You may have heard the saying, nothing about me without me. So if we're talking about the patient, let's involve the patient as much as the patient wants to be involved, of course. So that's the idea of partnering with the patient becoming a member of the care team. So what is the impact of using that question? Well, we need more research for that. We don't have definite answers about that, but there is some encouraging research, at least pilot research. You can see here the report from the British Columbia Patient Safety and Quality Council, and they did a survey. It's a small survey. It's only 49 professionals that have been interviewed. So this is probably not enough for some scientific founding, but it's encouraging results. 88% of the professionals see a positive impact on relations with patients and families, and 70% say it helps to be more responsive to needs. And when patients are interviewed, 70% says that the question improves the support from the care team. So if any of you are involved in research, I think we would welcome more research around the impact of the What Matters to You movement and campaign, but there are some promising and encouraging results to start with. So what does the literature and what does the experience say about success factors? Well, I've classified them in 3 categories. One is context. Of course, leadership support, like in any quality or safety improvement project, leadership support is vital. And if you have an organizational culture that is already tending towards partnering with patients and quitting a paternalistic approach, then it will really help the campaign if the campaign is inserted in a culture that is receptive to patient partnership. In terms of structure, having champions, clinical champions, I mean by that enthusiastic people who can testify about their experience, present it to others, champions within the institution, and project management, a good project leader, someone well-trained, enthusiastic, that's certainly a huge asset. And in terms of practice or implementation, the recommendation is to be flexible and to use local adaptation. By flexibility, I mean, I would advocate that you start in the sectors of your institution that are most receptive and open, and convince them first, and then partner with them to convince the others, and not try to convince the people that are most resistant to the idea. So flexibility in the deployment and local adaptation. It may be that a caregiver somewhere is not really at ease using the question, what matters to you, or qu'est-ce qui est important pour vous in French, or in your language. So there should be, the people should be allowed to rephrase that, reword that, and see what suits them better. Perhaps they are more at ease to say, what would be your goal for today? What would make today a good day for you? Or things like that. So adaptability and not to stick too closely to the question. Another important success factor is integrating the question in the daily routine. All of our colleagues working in the clinical area are already overworked, understaffed, etc. We should really try not to add work and not to add an extra burden. So it should be something that is done during a step of care that is already existing, during the medical rounding, during the case history in nursing when meeting a patient, etc. And every clinical context should find the best time to use that question. And of course, to follow up, ask questions to the teams. What does it change? How do you feel, etc. And also follow up at the patient level, give feedback to the patient. This is what we want to do because of what you said, etc. And give feedback. So these are, from our experience, the success factors. I mentioned tools that can help in the implementation also to leave a trace. So some organizations have dedicated a whiteboard at the patient bedside with the question, what matters to you? That's the image that is on the left-hand side of the screen. Or on the right-hand side, it's an extract of a structured whiteboard for patients. And you can see there is one place for patients to say what is important for me, just like there is a place for the patient's plan of care or language preference, etc., that can be on the whiteboard. It's interesting to see, for instance, at Walsall Hospital, they have used whiteboards for communication with patients with dementia and used the family to tell them what is important for the patient, or use the patient whilst he or she is in a position to still give input and then keep that for later for the care. So one thing I want to emphasize now is the link between the what matters to you approach and patient safety. Our experience at the Federal Hospital Federation of Canton Vaud is that we come about this topic of partnering with patient just about whatever safety project we tackle. I'm giving you 3 examples. We had a project, one of our first projects was to reduce adverse drug events through a breakthrough collaborative. And we noticed that if the patients understand their treatment, understand the medication that they're taking, they can ask questions, and these questions bring a lot of extra safety to the process. We had another collaborative on improving hand hygiene, and we noticed that if the patient sometimes asks the professional, did you do the hand hygiene? I didn't see the hand hygiene, etc. It stimulates us and it's very beneficial. Or for pressure ulcers, if the patient understands that every 1.5 hours, every 2 hours, etc., the patient should move, should redistribute pressure points, etc., then it can help a lot in preventing pressure ulcers. So I've taken 3 examples, but I could take many more, just about whatever topic in patient safety you come across. You will need patient engagement to help the process. Patient engagement needs partnership. The patient will engage if he or she feels that it's a true partnership and that the patient can trust the healthcare workers. But our question was, how do we produce partnership? We're not sure we're doing the right partnership at the moment. What can be the bridge to take us into patient partnership? And we came across the What Matters to You campaign from the United States, and we thought, well, that would be a very low-tech and easy to approach way to get into patient partnerships. So why don't we start there? So I'm not saying that What Matters to You incorporates every aspect of patient partnership, but I'm suggesting that it's a very concrete and hands-on and practical, pragmatic approach that is accessible to any person in healthcare to start. So the goal is to start systematically using What Matters to You, that question, in everyday care. That's really the goal. And the campaign is just a way to get there, but that's the goal. So I have provided a few references if you need extra information. FHV.ch is the website of Fédération des Hôpitaux Vaudois. WMTY, like What Matters to You.world, is the international website of the campaign, and you have a few hashtags that you can use on social media to find posts about all this. So I'll stop here for a moment, and I will hand over to Andrea to see if there are questions at this stage.
Thank you so much, Anthony, for this insightful introduction into the What Matters to You campaign. Now, we would like to open the floor for questions. Feel free to also use the chat to post your questions in English, German, or French. If you do want to ask a question or you want to post something, just maybe also raise your hand. Sometimes I think the chat demands for us to give you kind of access to the chat.
I see one question.
See one question?
With that, I see
Yes.
a question. Where is this integrated in Switzerland? So I know of a few institutions in Canton Vaud that have started. I know of some other institutions in other parts of the Western Switzerland, of the French-speaking world. Like I know Hôpital du Valais has been using it for a campaign last year. in Canton Vaud, in the Federation of Hospitals I work with, there are 12 hospitals. 12 of the hospitals do something on the 6th of June, like having posters in the hospital, having post-its for the patients, or posting items on social media. So that's 12 out of 12. About 5 out of the 12 have pilot projects in some wards, and 1 hospital has really integrated everywhere in all aspects of care, every unit, every ward, every department, etc. So for the moment, it's still an emerging campaign, and there are few hospitals that have spread it systematically in every ward and in everyday care, but there are.
Thank you so much for this question. Are there any further questions?
So perhaps what I can do is continue with the second part, and we can take a bit more time for questions at the end, if it suits you.
Yes. So with the second part, you will give a short report of the experiences you made during the implementation phase of the campaign in the French-speaking parts of Switzerland. So we're very excited to hear about that. Very good.
So my thanks to the institutions from whom I'm borrowing some slides. I will show you 2 examples. The first is Réseau Santé du Balcon du Jura, which is a care network in Sainte-Croix in Canton Vaud. And this is the institution that I was mentioning that is using it now in every part of the network. So Réseau Santé Balcon du Jura is an institution with about 300 employees in Sainte-Croix in the Jura Mountains in Canton Vaud. It has a small medical unit, 18 beds. It has an outpatient clinic. It has a nursing home with 70 beds. It has 2 medical practices for physicians, and a daycare center for elderly people, and protected apartments. So they started in 2019. It was the Discovery edition. They had post-its for all of the patients, and they asked patients to write what matters to them on post-its. Then in 2020 was during COVID, so there were fewer group interaction, but it was more on a one-on-one basis, the interaction with the patients. And in 2021, the institution came up with 4 strategic goals, which you can see here. First of all, roll out the campaign in all care settings, which means nursing home, acute care, medical technical units, daycare, operating room. I'll tell you an example. I found that very original. I haven't heard of any other institution using that before the operating room, but I'll tell you about that in a few minutes. And in home care as well. They experimented new ways of doing that with the coffee morning, where a few residents or a few patients gather around coffee to discuss what matters to them, one-on-one interaction, workshops, patient stories. They identified a champion in every ward, and they increased visibility through communication. So you can see here in pictures, this is an example of a workshop in a nursing home, and you can see that they've built a tree on a huge poster, and they have the patients have stuck post-its in the shape of fruits to say what matters to them and to hang the fruits on the tree. You can see here an example of coffee morning with discussions between patients about what matters to them. You can see here individual interaction between patients and caregivers. You can see patient stories. They filmed short stories of patients where they ask patients what matters to them and then use that for internal promotion of the campaign. This was a question that they asked in writing to the patients before going to the operating room. Do you have any specific needs or expectations before going to the operating room? So what came out of this? Well, I could tell you two examples. For instance, a patient writing, I'm afraid of waking up alone. Of course, it's something that is not so difficult to deal with, and you can be careful that the patient doesn't wake up alone. Another patient said, I'm afraid of being cold during the operation, feeling cold. So an extra blanket for this patient, etc. So I find this very creative, and I had not thought of, I had thought of the inpatient wards, but not of the operating theater. And of course, the Réseau Santé du Balcon du Jura uses social networks, both for internal and external awareness. So in 2022, they have really set the goal of tailoring the question to all care settings. So it means adaptation, discussing within the team, how is the best way to approach the patient and how do we customize the question that we ask to the patients. Reflect in every ward on how to integrate the campaign in the daily routine. So that means no longer a one-day campaign, but in every healthcare sector, and also asking not only patients, but also colleagues, also healthcare workers. So the team leader would, at the morning meeting, ask some team members also what matters to you. And I feel that in this post-COVID phase, where some people are a bit burned out and need to regain sense and team spirit, etc., this might be an interesting way of knowing what is important to our colleagues and how we can deal with that. So that was the first example. I'm going to move to a second example, which is Riviera-Chablais Hospital, which is a larger hospital. It's a 540 beds hospital. And you can see here a few pictures of how the campaign started. That was, I believe, in 2019. And you can see in the different wards, posters. They had post-its also for patients. They collected the post-its. They made posters to convert the post-its into the major topics that were raised by the patients. And you can see some teams here. You can see the central picture on that screen, which is the Department of Pediatrics, where they had a contest for children, and the children were invited to make drawings of what matters to them. It works very well with children's. It works particularly well when they are allowed to draw something, and you can see here pictures of the drawings from the children. Like, for instance, one child drew his bed and another bed beside it with his mum, saying what's important to me is that my mum can stay because I'm afraid at night and want my mother to sleep beside me. So that was the drawing from one of the children. And for example, in the Department of Gynecology and Obstetrics, Riviera-Chablais has really converted that into a standardized practice in everyday care. It means that every single couple that arrives at the maternity ward gets asked what matters to you for the delivery of your baby. And postpartum, every day after giving birth, every single mother is asked every day, what's important for you today? What matters to you today? What is your goal today, etc. It has not come completely naturally. There has been some resistance at the beginning of staff saying we don't feel completely at ease, it doesn't sound natural, etc. But the leaders have really insisted to say, we want that to become standardized practice, and it's not 90% of the mothers who should be asked that, it's 100% of the mothers, and it's not 90% of the days, it's 100% of the days that it should be used. So of course, it's up to you to decide what is relevant in your clinical context, area, etc. That's one testimony of one hospital who has made it really a standardized practice. It may be that you more use it at the arrival of the patient and not every day. I'm not prescribing to use that every day, but I'm prescribing to put much more emphasis on what matters to you and less emphasis on what's the matter or what is the health problem that you are facing. Here, I mentioned earlier in my slides that we are using breakthrough collaboratives at Fédération des Hôpitaux Vaudois. It means that we take a major topic and for 18 months, with all of the hospitals that want to work on that topic, we try to improve something. And what we've done after medication safety, hand hygiene, and pressure ulcers, what we're doing at the moment is improving handovers. So the communication between the professionals that are finishing their shifts and the new professionals who is taking the responsibility for the patient at the end of the shift. And you can see here our goal in 18 months in 10 hospitals, improve the reliability of handovers and have a 70% compliance to the iPass tool, which is a structured handover tool. And you can see in déterminant de premier niveau, you can see what we believe are the drivers. And we have a multimodal strategy. And one of the modes is engaging patients and families. So it means that we want people during the day, during the care, to ask the question, what matters to you? And then in the handover, we have observers, and the observers will assess if all of the items of iPass have been followed, but you will see number 8, patient experience is also presented. So we want in the handoff, we want the caregivers to hand over also patient experience and not just clinical aspects. And we also encourage the hospitals in this collaborative to test whiteboards. You have here an example of a whiteboard in the NHS in the United Kingdom with items of what matters to me. So these are a few examples. As you can see, we still have progress to do. It's not fully implemented in all of the hospitals of Fédération des Hôpitaux Vaudois, but it is on the way, and the feedback is enthusiastic. And so we really wish to keep going further. We have support also of our Department of Health. Our health minister for Canton Vaud is enthusiastic. She has been a member of the Swiss Patient Organization before she became Minister of Health, and she advocates that this sentence is used in daily care. So we are glad to have this support. So I think I'll hand over to you, Andrea, and I'm ready to respond to any questions.
Thank you so much, Anthony. Those were very interesting examples. And I think we already got our first question in. I don't know if you can see it, Anthony. It's in French.
Yes, I can see it. Let me just quickly.
So I'll hand that over to you. I think your French is a lot better than mine. So
I'll translate, whilst I read it, I'll translate the question in English. So from a logistical point of view, who collects the post-its where the feedback from the patient is? Does the professional easily find who to mobilize to respond to the care need for the patient? In the post-its which I talked about were used at the very beginning of the campaign to get an idea of what types of needs and requests there would be from patients. I am not sure that every single post-it was followed up on. It was more for the hospital to get a feeling of what matters most to patient. And most of the hospitals made posters out of that to remind the care team of what is most important to the patient. What I would advocate outside the What Matters to You Day on June 6th, when it is used in daily routine and daily care, is not to go through post-its, but to go directly one-to-one from the patient to one caregiver, and that caregiver sees if he can be autonomous and respond to the request of the patient, or if not, discuss it within the care team. That's the process that I would advocate. And sorry if I may have been misleading with the idea of post-its. It's not post-its on an everyday basis. It was post-its on the first campaign days in 2019.
Thank you for that answer. I think more questions came in. Another one was, do you keep these papers or ideas for improvement actions?
So one hospital, Hôpital Riviera-Chablais, that I just talked about, collected about 300 post-its in 2019, and they classified these post-its by topics. And then they used that for internal briefing and internal education of healthcare professionals to show what patients were feeding back as their needs. So I think that's an interesting idea. It's an interesting idea for the What Matters to You Day, but I think it's too complicated for to integrate in daily routine. I think in daily routine, it's a one-to-one discussion between a healthcare provider, a healthcare professional, and a patient. And it's important that the listening and the acting, considering what the patient requests, wants, and trying to do something about it on the spot is much better.
Thank you. And another question, is it being used in the ER departments?
I'm afraid I don't have the answer to that question. I know that Réseau Santé du Balcon du Jura uses it in the ER, but it's a small ER in small-sized hospitals. I don't have examples of other hospitals at the moment.
Well, hopefully after this webinar, we will see it in ER departments. That would be amazing.
Absolutely. Absolutely.
Are there any more questions? I can see one. So is the idea to collect the answers on the flyers during the action week and to evaluate them?
So the true idea is to insert the question, what matters to you in daily care, to build a relationship, to build trust, to build a partnership. And once there is that partnership, there are many things that become possible. And these things that become possible can make make care safer. I'll give you an example. I've been a chief executive of hospitals for 10 years before I went into quality and safety. I remember once the housekeeping department saying, oh, you know what happened today? We were watering the plants and we found some medication in the green plants. And I thought, oh, right. So that must be a patient who had side effects of the medication, but who didn't want to confront the healthcare professionals or the doctors. So it was a nice patient who put the medication away in the plants in order to avoid saying, they have side effects that I can't handle. Can we rediscuss my treatment? So my hope is that such situation could be solved using the what matters to you. Through the what matters to you, we build empathy. We start listening to the reality of the patient, and the patient can start saying, but I am not complying to the medication because of this, because of that, because it's unrealistic with my schedule, because etc. And if the healthcare professional knows about that, then they can co-produce a new treatment with the patient and come up with something that is much more realistic and therefore much safer, because it fits much better into what the healthcare professional understands that the patient is taking as medication. Also, for instance, in oncology, I've heard of numerous cases where when you ask the patient what the patient wants, it's quite different than what the healthcare professional projects. Often the healthcare professional believes that the patient wants more months to live, when in fact it might not be the top priority. The top priority might be the upcoming wedding of my granddaughter in 2 weeks, and I want to be there, and I want to have all my mind with me and not to be shooted by medication that will make me unavailable for the contact with my grandchildren, etc. And so what the patient wants is not always more. It's often less than what we think. So I also think that using this campaign is economically efficient and not adding costs, because often we overestimate what the patient wants in terms of high-end medicine and the fancy technology, etc. It's not always what the patient wants. So I would advocate that healthcare professionals think of 3 of their patients, write down what they believe what is important for these 3 patients, then go and ask the patients what is important to you and study the difference. What's the difference between what I believed was most important for my patient and what the patient says is really important for him or her? Sorry, that was a little bit of a long answer to a short question.
No, that's perfect. Thank you so much. Also, if you do have specific questions in regards to the upcoming Action Week, please don't hesitate to contact our project leader, Malinda Kocher, by email. We have further questions, Anthony. So another one would be, and I hope I understand this question correct, does it also entail patients' desire for full COR or no COR? I'm not sure what... Maybe you can.
I'm guessing it's referring to resuscitation directives. Should we resuscitate or should we not resuscitate? For me, it's a very important topic. It could so advanced directives, knowing what the patient really wants. I think it's one way of getting to that. I'm not sure that is what the question is about, but it could entail that. So I think the content of the focus of the discussion between the healthcare professional and the patient is going to be different in every clinical context. It's not going to be the same in the emergency department or in oncology or in pediatrics, etc. But what is there could be very meaningful for some environments. Mm-hmm. And I see a question about confidentiality.
Yes.
Whiteboard. That's all, of course, an important topic of discussion. So it should be, the patient should be reminded that what is on the board will not be fully confidential, because it can be a room with many patients and then there can be visitors. On the other hand, when there is the medical rounding, it already happens that in the rooms, there are some private discussions that other patients hear. So we can't guarantee complete confidentiality, but so it's not everything that can be written on the whiteboard, of course, but in terms of what matters to patients, I don't see too much of a risk of that occurring, but we should watch that. It should be a preoccupation.
Perfect. And another question, are there already experiences or projects for the outpatient area?
We are currently working on that. So there are a few hospitals in the French-speaking part that are planning this for 2024. But not, apart from Réseau Santé Balcon du Jura, not much experience in the outpatient, more in the acute inpatient departments for the moment. But I'm sure there are opportunities in the outpatient world as well. The thing is, Fédération des Hôpitaux Vaudois has more inpatient than outpatient, so we don't have much experience with that. And I see the comment about CPR or full CPR. So
yes, I think
that's what we were talking about. Thank
that
you.
referred to the previous question. Perfect, thank you. Are there any further questions? Otherwise, I will ask a question, Anthony. If someone is interested or thinking about implementing the campaign in their institution, then what would be the tips or pointers that you would give them to start this whole process off?
I would advise starting small, starting using a few days and using, for example, one ward, and taking a ward where you know that there is already some openness, have already been some discussion about patient-centeredness, about partnership with patients, etc. So wards that are receptive to that and trying it out. If you have the opportunity to take the opportunity of next week, that would be wonderful. If I am predicting that it will probably raise interest and some enthusiasm. And once you have that, you can have the people that have used it talk to the other people in the other wards, the other departments, etc. And perhaps next year during the What Matters to You Day, spread it in a second ward, in a third ward, etc. So I would advise starting small, testing it, etc. You may think, well, we don't have much time, it's next week, how do we get organized, etc. But to do a pilot in one ward is not really a very complicated thing. It might be just the goal to say, okay, there are 15 people in the team. Let's say every one of the 15 people asks once the question to one patient. So we'll have 15 interactions, and we discuss then these interactions within the team. Did it change something for us, for the team? Did it change something for the patient? What is our impression, etc.? That's starting very small, but I think it's a way to start. And then also asking ourselves the question, do we think in the impacts, there are impacts on patient safety? What kind of impacts on patient safety? Does it help? Can we spread that, etc.? So that would be my advice.
Thank you so much. And we already have another question. Did you observe better healthcare providers' job satisfaction too?
We did, but not with a scientific survey. So it's stories that have been reported. And so I hear an overwhelming number of stories where people say, asking that to the patient gave meaning to my work. And it gets me back to the roots of why I have chosen this profession. It makes sense, it provides meaning, it's very helpful, etc. Also, there have been some testimonies of people where it's been used within colleagues, where the team leader has said one morning to all of the team members, what matters to you, Paul? What matters to you, John? Well, etc. And this has also helped the team to do team building, etc. So these are the impressions, but I cannot say that this with certainty, with scientific rigor. It's based on experience and stories and not based on a survey.
I think part of this question also has a little concern in it, maybe in regards to how should we manage all of these patients' extra wishes in our busy professional life. Maybe you have an input to that, Anthony?
Well, I think the experience from the 5 hospitals of Fédération des Hôpitaux Vaudois that are using that is that perhaps 1 out of 30 cases is a bit of a challenge to respond to, but most of the things are very simple things. It's a blanket before the operating room not work. I need to breathe the outside air and not just to be inside. Okay, your next physiotherapy session might be outside. The physiotherapist will take you outside. Use the opportunity of something that is done in any case to answer that. And so most of the time, it's very simple things. It's wanting to be heard, to be listened, to feel valued, etc. And it's not costly things. Okay, perhaps 1 out of 30, and then perhaps we need to feed back to the patient. We've heard you. We'll see what we can do, but exactly respond to your question is out of our reach, etc. So it's possible to discuss these with patients, but it's really not as complicated.
Okay, thank you. I see we have another question. Maybe we can ask it very quickly.
Yes.
Is there a cooperation within Europe?
Yes, that's exactly what you will find on the What Matters to You World website. It's a list of countries. It's more than Europe. You will find countries in on the American continent as well, a few countries in Asia also, but quite a number of countries in Europe. And all of the discussions that are being held internationally for the campaign go on that website, which is referenced in the slides, which is wmty.world. There is an international group. I participate in this international group with a delegate from all of the different countries to coordinate the campaign.
Perfect. Thank you so much. Well, we have come to an end of this webinar. Anthony, we would like to thank you for presenting the What Matters to You campaign to us and giving the audience an insight into your experiences. We would also like to thank all the attendees of this webinar for the participation and the questions. You will find materials about the campaign as well as the whole Action Week toolbox on our website, www.patientensicherheit.ch. We will also post this link in the chat. And of course, we hope that through this webinar, some of you have been motivated to implement this campaign into your institution. Then another quick information. Next Monday, the Journée Latine de l'Excellence en Santé will take place in Estavayer. Anthony will be there as well. And registrations are still possible. You will find more information on this event as well on our website. So last but not least, of course, we wish you all a successful Patient Safety Awareness Week next week. And we wish you all the best and have a sunny remaining day. Thank you so much.
Thank you very much, Andrea. All the best to everybody.
Thank you. Bye. Have a good day.